Welcome back to Survivor's Guide to Breast Cancer, and I am Dr. Shazia Hyder, and today we're going to be talking about Survivor's Guide to Surgery. When you're diagnosed with breast cancer, surgery is almost an inevitability of your treatment plan. Whether you go through anything else, whether you go through chemotherapy or radiation, you will need surgery for sure, mainly because you have to get that cancer out. And so it is so important to see a surgical oncologist and ask them their opinion. And if you're not comfortable with their opinion as to what your treatment options are, to go and get another opinion. I took two opinions. I did go to Loma Linda University, but I ultimately went and had surgery with Dr. Christy Funk. And Christy Funk is very well known. If you Google her name, you'll find that she's been on television, and mainly because she rose to stardom because she performed Angelina Jolie's bilateral mastectomy, which of course Angelina did prophylactically on account of having the BRCA genes, and of course that gave her a much higher risk of getting breast cancer. So I would just say that the best advice I could give, having gone through this myself, would be to look at all the options and see what makes sense and ask very intelligent questions. You would want to try to go for the safest option, which is least invasive, meaning that if your cancer can get away with just having a lumpectomy, which is just taking a small piece of the breast tissue out, then go for that, because having gone through bilateral mastectomy, it is a very invasive procedure. It is very painful afterwards, and you are very different afterwards, of course. And I will tell you a little bit about bilateral mastectomy. Of course, at the same time, I had tissue expanders placed, and so there was a lot of pain involved. And after having a bilateral mastectomy, you do end up having drains, which when you're in hospital, make sure that somebody counsels you as to how to empty those drains, because you're going to go home with those drains and you're going to have them for maybe a week or two. I also unfortunately had complications secondary to my surgery, and that complication was that I had a threatened skin flap. That was having Christy Funk performed a nipple and skin sparing mastectomy, which meant that she spared both of those features in my body because they weren't a risk to leave them there for me. But unfortunately, afterwards, my skin had the blood supply became very poor, and it was dying, essentially. The skin was going to be lost. And so as a result, I had to have hyperbaric oxygen treatments. And I will briefly touch on hyperbaric oxygen treatments. They are not for people who have claustrophobia. Unfortunately, I do have claustrophobia, which I got over within minutes of getting into this chamber. You go into a chamber which you are completely enclosed in, and they surround you with 100% oxygen, and then they pressurize that unit so that that oxygen is now under pressure. And so and they call them dives, and I was having these dives sometimes twice daily, once daily, and I did have 30 sessions at that point. I did later have to have hyperbaric oxygen, so I've had a total of 70 hyperbaric oxygen treatments. So just to overview about hyperbaric oxygen, it is for wound healing and for a number of other indications, and it uses 100% oxygen under pressure and is very effective. It's just a wonderful treatment to have. So getting back to the surgery, afterwards you will have an area of numbness. And for me, I had bilateral mastectomy, so most of my chest wall is now numb. So that is something really important to know, because with the pain, you want to use heat packs or cold packs. And so you must be very careful not to burn your skin, because unfortunately I did burn my skin, and the healing was very poor in that area. So to this day, I have a burn scar. And so it is important to know that you will not have sensation to that area. And so this brings me on to my next rule, and that is to look at yourself in the mirror after your surgery and get used to your new normal, and realize that you can be affected by tight clothing. That is why you cannot have wire bras. Of course, there's not much use to have bras if you've had bilateral mastectomy, but if you're still wearing bras, you want to wear a sports top or something which doesn't have an underwire. And just get very used to what is normal and what is not normal, because you want to know if something looks abnormal and have it checked out, in case you see any new lumps and bumps. And that is so important to do. I think I've covered most of it for the surgery. One other thing is pain control. You will need pain control after your surgery because it is so painful. And so your surgeon will give you some medications to go home with. Take them as you need. Opioid narcotics do cause constipation, so use Docusate or Colaze, stool softener, prune juice, whatever it takes to help with that, with the bowels, because you need to have the bowels moving, otherwise you have a new kind of pain. And really just getting used to being different, and then talking to your team about what is next on the treatment plan. And I will go on and talk about more of our survivor's guide. So stay healthy and keep screening. All right. Thank you for listening. If you like this and you think somebody may benefit from listening to Survivor's Guide to Breast Cancer, please do like and share me. Thank you.